Cast is now starting. All attendees are in listen-only mode.
Oh, it looks like there are attendees. Hello, everyone. I'm just going to give a couple more minutes for people to join. And I'm unmuting everyone's line so that they can speak up during the phone call. Okay, I think everybody has joined the phone call. Good afternoon, everyone. Can I just make sure everyone can hear me?
Hey, Taki, it's Robin Scala.
Yes.
I can
Hi,
very
Robin.
clearly.
Okay, great. I just wanted to make sure everyone could hear me. So thank you all for joining us. Today is the kickoff call for the National Center for Health and Public Housing's pilot project to promote the use of CDC tips from former smokers to public housing residents. So thank you all so much for making the time to join us today and to get this project started. We're all very excited. Before we begin, I just need to make sure I go and show you the disclaimer, just to make sure that you know that all of the opinions that and discussion that we're having this afternoon is the National Center for Health and Public Housing and doesn't reflect Health and Human Services. So this is our agenda for today, but I just wanted to let you know that I do have a couple of slides that I'm going to go through, but I wanted to make sure that you all understand that this is not so much a formal presentation, but an opportunity for us to talk, get some details and some background information from you all, and go through the project activities and any questions that you might have. So I'm going to start with introductions. I'd like for everyone to just kind of speak up and let us know who has joined the call today, your name and your organization. My name is Saki Malacho. I'm with the National Center for Health and Public Housing. And then if I could ask anyone from NCHPH to introduce themselves, and then Robin, and then we can go through all of the attendees. Jose, are you on the line?
I am on the line. Hello, everyone. My name is Jose Leon. I am the Chief Medical Officer for the National Center for Health and Public Housing.
Hi, this is Bob Burns. I'm the Director of the National Center for Health and Public Housing.
And then Robin?
Hi there. Good afternoon. I'm Robin Scala, and I'm a Health Communications Specialist in CDC's Office on Smoking and Health.
Okay. I see Adrian James. I think all the lines are unmuted, but if you guys can just speak up and let me know who's on the call.
Hi, good afternoon. My name is Gloria Zapata from Borinquen Medical Center.
Hi, Gloria.
Hi, this is Yvette Young and Barbara Willis from the Hampton Roads Community Health Center.
Thank you for joining us.
Hi, this is Amber King from Alabama Regional Medical Services.
Hi there. Is there anybody else on the line? I think that's all I had for the RSVPs. Okay, great. So let me go through the next slide. So some of these slides will be a little bit of a refresher from the webinar that everybody attended a couple of weeks ago, but I just wanted to make sure that we are all on the same page with the purpose and the objectives of this study. The CDC has some great resources on smoking cessation counseling, and those resources have shown to be impactful as far as increasing tobacco cessation conversations with patients that are at health centers. And so we wanted to try to promote the use of these materials and educate healthcare providers on what's available from CDC, and also to kind of increase those conversations with patients that are visiting the healthcare center. And we also wanted to evaluate this pilot project. So those are the main objectives of the study, which I'm sure you're all aware of. And the funding is being provided by a contractor from the CDC. It's from the Plowshare Group. We have a modest amount of money that is available to each of the health centers to kind of offset the printing costs. And we're offering $750 for each of the healthcare sites. And we're hoping that that will be useful to get those materials into the health center. And congratulations to all of you for participating in this pilot project. We're very excited to get this started, and we had 5 health centers that we chose to participate in this round. And here are the names of all of the grantees. So there's the Norton Sound Health Corporation located in Alaska, Alabama, which is on the phone today. The Barican Medical Center, Miami, Florida. Gloria's on the call today. And then Foremost Family Health Center, which is located in Dallas. And then Hampton Roads, which I heard is on the phone call today. Some of the health centers weren't able to join today, and we'll have a follow-up call with them. So welcome to all of you all, and thank you for participating. I was able to pull some baseline data from the UDS 2017, just came out, and I just wanted to show you all just a sense of where you all are as far as the total patients that have tobacco use disorders, and that's our proxy measure for the number of smokers at a health center. And then the patients that are receiving smoking cessation counseling, and then the clinical quality measure, which is the tobacco users with the appropriate follow-up. So as you can see, there's quite a range of tobacco users at your health centers, anywhere from 303 to 1,000. And then the total patients that are receiving smoking cessation counseling, also a huge range from 2 to 500. But it looks like the health centers are doing quite well with the number of tobacco users that are receiving the appropriate follow-up care. It looks from 85% to 99%. But I'm going to pause here, and I just want to hear from you all just to kind of get a sense of the patients that you see in your clinic and your delivery of smoking cessation services. If you could just let me know, what's going on at your health center. Is this something that you all provide? And is this something that your patients need? So why don't we start with Alabama, the folks from Alabama. Can you just describe? Thank you.
Hey, this is Amber. I'm not sure if Adrian's been able to join the audio. Our providers do one-on-one education primarily. We see a wide range from many of the public housing, many homeless, and then we see a variety of other folks as well. And our primary, we have some handouts that, but I'm actually not sure where those originated from. Primarily, it is one-on-one counseling by the providers.
Okay, great. Gloria, can you talk a little bit about what you all do there?
Yes, our primary care providers with the medical assistant, they assess the patients in every session, and then they refer them to me. So I'm conducting group counseling with the support of AHEC. So they send me materials and NRT products, the patches, lozenges, or gum to the participants. This is a 6-week group counseling, and also I do the individual sessions in my office.
Great. Great. And then the folks from Virginia?
Hi. Yes, much of ours is also provider driven. We do collaborate with a variety of partners and also providing the smoking cessation counseling, as well as those that have the ability, we do refer them for the medications. So that's what we're doing here.
Great. And I just wanted to, I took off the identifying health center information on this chart, but I just wanted to get a sense from you all. Did these numbers kind of look right to you? The patients that come in to your health center that are tobacco users, and the number of cessation counseling referrals that or visits that you're making. Do these numbers kind of look right, or does it look low or high or
High for public housing. The appropriate follow-up seems a little bit high for those for public housing.
Mm-hmm. Anybody else, Gloria or from Alabama, Amber? Do these numbers look familiar to you, or does it look a little high?
About oh, I'm sorry.
The first and second column probably look pretty close, but the appropriate follow-up is higher than I think it's higher, especially for public housing patients.
Okay. And you all are, when you all are collecting this information, so this is what we receive from UDS, and I know that's what you all do, but at your health center, are you able to distinguish between public housing residents and then your total patients that you see at the health center? I know you're not required to report that straight to HRSA, but sometimes health centers are able to distinguish the patients.
At Birmingham, we can determine the number of public housing patients, but we don't stratify the other UDS measures and break it down by who's public housing and who's not.
Yeah. Okay. Bob or Jose, do you have anything else to add on this section?
Yeah, thanks, Saki. I just had one question. I'm going to, I guess, direct it to Amber, but anybody can chime in on it. And she talked about referring people to one-on-one counseling, and I'm wondering if you could elaborate a little bit on the nature and content of that one-on-one counseling that's provided by the providers. And also, you mentioned also that you give them a handout, and I'm just curious as to the nature of the handout.
The handout is, I had seen it. Not an assistant or provider working bedside, so honestly, I can't speak to the handout, but I have observed the providers with the counseling, and much of it is, talking with the patients if they about techniques, the need to quit, but then those who can and have the means to pay for it. I do know that medications sometimes are given. They talk about different options for stop smoking aids.
I just muted a couple of the lines because it It appears that there was some background noise, but I'm going to start unmuting everyone so that you can hear and speak up if you need to.
Sometimes when people have their cell phones close to their regular phone, if that's an issue, it sometimes causes that interference on our webinars, I know, by the way.
Yes, hello everyone. Can you hear me?
Yes.
Okay, this is Anthony Gardner with Alabama Regional Medical Services also. My phone was muted earlier, so I'm on the call as well. And I see we have Amber on the call also from our organization. So just wanted to let you know that I was on the call.
Okay, thank you so much. I think we're all unmuted now. Thank you. Okay. Moving along. Okay, so this is the list of all of the project activities, and I know we've discussed this, but I thought we could just kind of go through it one by one. I think the first step is educating staff at your health center about this pilot project, about the CDC tips material, and about using the material in the health center settings, either by your either it's your medical assistants that are providing the counseling, or your providers, or the physicians and the nurses that are doing the tobacco cessation support. But getting everybody on board and letting them know that this is the project that you all are working on this project, and that we're trying to increase the delivery of these materials. The second step is printing out the materials and placing them throughout the health center site. And I'll show you later on a slide that shows where people are placing their posters in the waiting room and in the office. The next step is, conducting the conversations, trying to be a little bit more proactive in having these smoking cessation conversations and engaging with patients if they're interested in quitting smoking. And then the next step is tracking the data. And our hope is to not tax you with additional information, and just use the measures that you're already reporting to HRSA, so that you can, so that this could be an easy step for you, and we're not asking you to collect information that you're not already doing at the health center. And then conveying means, sending us the information and then evaluating the project. So those are the major steps. Does anybody have any questions about any of those activities?
No.
Okay, great. So again, these are the requirements, and essentially it follows all of those project activities. The one thing that I would like to go over is that we do have 2 forms that we're asking you all to fill out at the project end. The data on the smoking cessation measures, which is the final data report form. It's attached to this webinar, but I will send it to you all in a separate email following this call. And then also some qualitative answers about using this pilot, asking you, if just kind of these open-ended questions. Have the materials been helpful? Have your healthcare providers been educated on this? And have you seen any impacts on the use of the materials, any lessons learned, etc.? And then we'll have a brief evaluation survey at the end of the project. So here are those forms. And again, I'll send those in a follow-up email. And this is the type of information that we're looking to try and gather from your UDS data. So just wanted to make sure that this would be easy for you all to do. Can I just get a sense from you all if this is something that you...
Oh yeah, this should be pretty simple. It's part of what we do anyway in terms of managing our care team model, patient-centered medical home. So these should be fairly simple questions to ask. Now, it depends on the patient themselves to determine if they want to answer or not. But yeah.
Okay, great. Thank you.
These are all realistic.
Okay, good. That's what I wanted to know. So I'm going to switch over, Robin. I just had some of your slides that you provided a couple of weeks ago, just on where the TIPS information is located. I'm going to flip through them because I know you don't have access to the slide. But just if you want to say anything about any of the slides that I'm showing up, just let me know. So this is where the CDC TIPS information is located, cdc.gov/tips. And this is where you can find the partner pages.
And I can add to that so the previous slide was our main TIPS page, cdc.gov/tips, and that's where all of our resources are, and anything that we mentioned you can actually get to from this page, from one of the sections in this page. So if you want to switch to the next slide, the partner pages, you have to scroll down, oddly enough, to the bottom of the main TIPS page, which was on the previous slide, to get to where the partner pages are. We're thinking of renaming these, but instead of partners, but there's a little link at the bottom right that says partners, and you click on that, and this is where you find all of these different pages. And if you look at the third one on the right that says, oh, no, sorry, that's not true. If you look at the second one on the right that says healthcare professionals, if you click into that, it even breaks groups down further into like dental health professionals and things of that nature. But the healthcare professionals page is where you can find a lot of really helpful resources, just so that I think will be really applicable to all of you. And then of course there's the behavioral health professional information too that will be helpful to, I can't remember, I think it's Gloria. And then also, of course, we have our organization serving public housing residents page that's there too, that has our new, we have a flyer that you can hang in your clinics if you want, in addition to the TIPS posters that you see here, which our posters are in English and Spanish. And we have many more than this in both languages. And then these are just examples of placements of TIPS posters that folks have placed in the community. But a slide that I had updated since this presentation, there's a great photo of one of our TIPS posters on the inside of an exam room on the door when a patient is waiting in the room. That's a really great example because people find a lot of success placing the TIPS posters in waiting rooms, but also in the exam rooms when you're waiting for the healthcare professional to arrive, or when you're in there with them.
And
sorry, Saki.
Yeah, so, and I just wanted to ask quickly, CDC also has like videos, ads that you can place in the waiting rooms, TVs in the waiting rooms. Do any of you all have those kind of TVs in your waiting rooms where you can place those types of ads?
Yes. Yes, we do.
Yes, we do in Borinquen. I just need to contact IT to make it up.
Great. And then in Hampton Roads, do you all have TVs in your waiting rooms?
Can I ask a question about the posters?
Sure.
Sure.
So will these posters be provided to us, or will we have to utilize the funding to purchase these? And if so, where, how to purchase these posters?
Sure. So you can download all of the posters from the CDC website. We are planning on providing the stipend at the end of the project period once we receive all of the project deliverables. And so we're asking health centers to print out the materials, and then we would just, I guess it would be more like a reimbursement at the end. The stipend would be provided. Bob, do you have anything to add to that? Or Jose, are you guys on the line?
Yes.
I guess.
Jackie, do you want me to elaborate while you wait for them? Maybe.
Go ahead.
Back. So the posters that there's a handout that's also available that shows you how our download center works, but we have the posters, all the print materials and the videos for free placement, which is what you all are doing, placing them in your health centers. You can download them for free, and you can print them out in color in your offices if you have those printers, or you could bring it to a local, like a Kinko's type place, and print them in different sizes. But there's no cost to use the posters because you're just doing free placement within your own health clinics. So you could just print them out as is. I will mention, Saki, that as far as the videos, it's my understanding that the looped video fields, the videos are available if people want to download and use them. But if they want a looped video, you all want to pick and choose which videos you want, and for us to make it into a continuous loop. Our contractors at BioShare Group, which is the site where this is hosted, and their contact information is on the front, or I can certainly help you. They can make you a customized looped video of tips ads too. I wanted to mention that because they took down the old looped videos. All the videos are there, but if you wanted to make your own, you can help. You could if you want.
And Bob and Jose, are you all able to?
Yes, thanks, Saki. I think the way you explained the reimbursement is correct. You know, if somebody has some special circumstance, you can let us know, but that's our plan of action.
Okay.
Okay.
Can you repeat that again about the reimbursement? We couldn't hear.
Yeah,
Kind of broke up.
I think the intent was that you guys would go ahead and do and basically afterwards. That's the way we'd like to proceed. But if somebody has a unique need and would like to try an alternative, they can let us know.
Okay, we still it's like there's a lot of background noise, like someone else is talking, so we couldn't hear all of that.
So hi, I'm sorry, I put everyone on mute so that Bob could just speak so that everybody could hear it. Go ahead, Bob. Sorry about that.
Okay, yeah, no problem. The plan is that you guys would go ahead and do your printing of the various materials, and then we would provide reimbursement after you did so, and that's the way we'd like to proceed. However, if somebody has a circumstance where they're just really up against it and need some assistance in order to go ahead with any of the printing, we can talk with you on a one-on-one basis about maybe doing something up front. Okay.
Okay, thanks. Let me unmute everybody so that they can answer questions if they need, ask questions if they need to. Sorry, I have to do this one by one.
Yeah. Mm-hmm. The water for.
Okay, so everyone is unmuted, and I do hear some background noises, but I just wanted to make sure everyone had an opportunity to ask a question if they would like to. Okay, Robin, do you want to go over this slide?
Sure. So this slide complicates things slightly, but it's not complicated. This is just a breakdown of the different locations where CDC provides its TIPS campaign resources. The one is kind of in reverse order. So all the way on the right, the orange one is the TIPS website, and that tells you what's available there for what types of uses. So as is materials are available there with the CDC logo, and then it just tells you a breakdown of the types of materials that are available on our website. The center section, which is green, is, I think, where you'll primarily go to download all of your resources. And that email is www.plowsharegroup.com/CDC tips. And that is our media contractor site that we presented on last time, and we have a little how-to guide, but if you need help you too, and they can help you. And that's where you also download as-is materials for free placement. And that's where, Saki, we were talking about where all of the ads, the print materials are that you guys can pick and choose, and we'll talk more about that in a second. But that's kind of the go-to place where you download print ads and the looped videos or the individual videos. And then one all the way on the left, it's blue, the Media Campaign Resource Center is not something you would use for this particular intervention, but that's where you go if you want to tailor ads, like if you don't want the CDC logo and you'd rather use your local. So instead, you go there. Also, you go there if you're paying to place materials. So if you were doing a media buy, for instance, you would go there because you need a licensing agreement, which is a little different from printing your own posters and just hanging them in your house.
So I am still, thank you, Robin. So I am still getting some background. So what I'm going to ask you all to do is to mute your own line, and that way, we won't get all of that back.
This is Yvette from Hampton Roads. I have a question. Hello?
Hi, Saki, I don't know if you want to, if you could, oh, there you go.
Okay. All right, I'll go through and then unmute everyone again, okay? All right, hold on just a second, Yvette. Okay, Yvette and Robin, you're on. Go ahead.
Okay, I was wondering, what is the grade level that the materials are written to? Some of your brochures. Do you know?
So I'm not sure about the grade level per se, but I'll tell you that our media campaign targets low SES audiences, and that's based on income and education. And so these ads are created, like the basic poster ads, for a broad array of audiences. And so that should not be an issue because we keep that in mind because our target audience has of smokers has a lower, education and income level overall. And CDC has plain language requirements. And so we have to keep all of our materials to a certain level so it's not complicated scientific language. It has to be cleared to be understandable by a broad array of audiences. Do you have a concern about anything? I can find the data for you if you'd like.
No, you don't have to do that. I just want to know. That was very helpful. Thank you.
Yes. So we keep that in mind because when we're creating the materials, and not to mention that we're also required by law, by federal law. But we do ensure that they're, you know, plain language, easy to understand and easy to process too. And we also have strict, we do focus group testing and perceived effectiveness formative testing to ensure people are able to easily understand the messages.
Okay, thank you.
And we have culturally competent translations for the posters are in Spanish, or the ads are that are in other languages to ensure that that translates well.
That's good to know. Thank you.
Sure.
And so, Robin, the next couple, okay, I'm going to go ahead and mute everyone again and just unmute Robin. If you do have a question, just maybe you could raise your hand to let me know that I can unmute your line. Sorry about this, guys. Robin, do you want to, these are the download center instructions that I had from your presentation.
Sure. So I actually have to get another phone. My phone's dying, but I will talk to you while I do that. So the material, the download center front page that you see there on the slide, it takes about 30 solid seconds to upload. Hold on one second, please. Okay, just want to make sure I'm not hanging up on myself. Can you still hear me, Saki?
Yes. Yes.
Okay, great, thanks. So the download center, you get to the download center by the address on the bottom of the slide, which is plowsharegroup.com/CDC tips. And you wait 30 plus seconds and the page will eventually look like this. It looks similar, but different when you first upload it. It's just uploading all the data. So the slide, as you see across the top, there's an overview tab, which is what's selected here, and there's contact information. If you need any assistance or special, you know, tailored materials, or, you know, you want to pick and choose your loops videos, you can contact the folks listed there, or you can let us know. But across the top, you see it says PSAs, prints, radio, digital, low resolution videos, which are what you would use on your closed caption TVs in waiting rooms, out of home, which are billboards and bus shelter type larger and different sized print materials. Then there's a healthcare tab, and then the HUD tab just has materials that tips materials that we use to reach HUD housing audiences. But you can use any of the tabs to download the materials you want. I would think that print and low resolution video and HUD are the tabs that you would most commonly use. So you have to click the top of that. And then oddly enough, the different ads are organized by year, which we know is not intuitive to anyone but us, but that's how they have uploaded them over the years. So you'll want to click around on Tips 2012 under each tab. So, you know, print is different than video, which is different than, you know, everything else. So when you're in the print tab, click around through the years, because you'll see different ad participants materials in there that you'll want to pick and choose from. Like Roosevelt heart attack is under Tips 2012, whereas Felicita oral health ad is on Tips 2014. Anyway, you'll see when you do it. But you basically click the little boxes that are there. If you like an ad and that's the format or size that you want, you put your little, you click on it and it makes a little checkbox, and then you can upload or download those to your basket. You'll see that your little basket will change, just like if you do online shopping. You'll see that you have more items added to your basket. And then when you're ready to download everything, you have to accept the terms and just download the materials to, whether it's your computer or you're putting them on a thumb drive or what have you. And if you need help with that, you can let us know, or the folks at Plowshare Group know, and everybody's always happy to help. Okay. And then this is contact information for me and for my colleague, Shelley Hammond, who also works on TIPS partnerships.
Hi, this is Yvette. I have another question. Can we add our logo and contact information onto the materials?
So you can't, and then this is something, you know, you're, Saki and Bob, you all are going to need to decide if you want it with the CDC logo or if you want to change it to their own logo. I don't have an opinion on that. You cannot co-brand, though. So you have to decide your logo or our logo. And if you're going to change the logo, you do have to go through the Media Campaign Resource Center. There's a nominal fee, or they could give it to you if you have someone else that does your retagging, but it's not a very expensive fee, but you would need to do it to all the different materials because there's no co-branding. It's your logo or our logo, which is fine.
Okay.
Okay, that makes sense.
I see that Anthony's got his hand raised. Anthony, you can go ahead. Do you have a question, Anthony? I guess not.
He's stuck muted, or did you unmuted him?
Yeah, I did. Okay.
These are all good questions, though. People do often ask these, so I'm happy to hear questions to help.
So just a next step, we will be sending an email. Bob and Jose, I unmuted you as well. So we'll be sending an email with some follow-up information, the forms, the slides, all of the PDFs, the recording for this call, as well as, which I think might be useful to you, is the National Association of City and County Health Officials, or NACHO, did a similar type pilot project with local health departments. And their final report includes some lessons learned on the program implementation and then some background information on how the program has impacted their health center and their patient care. And so if you wanted to take a look at that information, it might be helpful as you structure this project at your health center. And then I'll be following up with everyone to schedule a call next week just to discuss your plans on educating and training staff and talking through any questions you might have about printing and disseminating the materials in your health center, and then any follow-up questions on tracking and reporting data. So I want to ask people if they have any questions. Now's the time to ask those questions. Anthony, I do see that your hand is raised. I unmuted your line. Do you have any questions?
Yes, no, ma'am. I don't have any questions. That was a result of me not being able to speak through my telephone. So,
sorry.
So I'm fine.
Okay. If anybody else has a question, if you could just raise your hand on the chat screen, and I will unmute your line. Okay. Again, this is the pilot project timeline. It is quite quick, so we are hoping to get this started as soon as possible, and get those materials out to you all as soon as possible. At the end of November is when we will be doing the final evaluation.
Okay. Yeah, this is a quick turnaround, so we'll get busy.
Yeah. Okay. Does anybody else have any questions? Let me know. I did unmute everyone just in case anyone wants to speak up or speak out. Okay.
While people are thinking, I just want to thank everybody for being willing to participate. We've been very involved in smoking cessation and smoke-free public housing the last few years. A great opportunity to try to further some of the cessation goals. What commits us to it is the fact that, whereas the general population, about maybe 13 or 14% of people are smoking, about over a third of public housing residents are smoking, and health impact is just horrendous. And in some of our work on smoke-free public housing, a lot of people have asked for assistance with additional resources, and we're very pleased that CDC was willing to provide this, and hopefully the lessons learned from your efforts, we can use those results to kind of promote this, with other health centers across the country. So thanks to all who are involved.
Yeah, and I'll second that motion, Bob. We're really excited to have all of you do this. I know we had a handful of others do this previously, but we really are very, very pleased that you're interested in this project and that you are going to include the TIPS resources and track this information. It's so valuable, and so thank you so much. And definitely let us know if you need any assistance. We're happy to help in any way to make this easier for you. I know that folks who have done it before had a lot of success, and they actually kept it going after they instituted it, and so hopefully you'll feel that way. Ask us anything, and we're happy to help you.
Okay, great.
Thank you.
Yeah, thanks everybody for joining, and I'll follow up with all of you by email. Thank you.
Thank you.
Thank you.